Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Today, we'll be talking about an aspect of medical education that some listeners may want to get involved with. The Standardized Patient Program is part of Upstate Medical University's Simulation Center, and my guests are Dr. Hesham Masoud, the director of the SIM Center, and Matt Capogreco, the program director for the Standardized Patient Program. Welcome to the Informed Patient, both of you.
Thank you. Pleasure to be here.
Dr. Masoud, why don't we start with a description of what the Simulation Center is?
Yeah, so the SIM Center is essentially a microcosm of the healthcare space. And so if you think about it as being a place where you can recreate all of the different spaces in a hospital or clinic setting where healthcare is delivered, and it's for the intention of healthcare students across the board that represent medical students, nursing, and health sciences broadly to acquire skills that are relevant to their practice after the fact. It's also this really cool place where, because of its infrastructure, we do training across the gamut of graduate medical education and practicing healthcare providers. So this is a unique place where we do something called interprofessional education, which allows for collaborative learning across disciplines.
So all of the students at Upstate may potentially end up in a SIM Center for some course or some program along the way.
Yeah, a lot of curriculum include simulation already and are actively converting their curriculum to include it because it's the best way that adults learn is through experiential learning that is contextual and has external validity to the endeavor that they're going to be doing after training. And simulation affords all of these things. And we're in this exciting time where technology affords us this high fidelity resource across the gamut of different technologies that we employ, such that the simulations really feel like the real thing.
So I can see as a student, it would be beneficial to sort of have that practice, but as an educator, you can give feedback to these students in a way that would be more difficult to do in real life.
Yeah. So in addition to those resources that I sort of touched upon lightly that have to do with task trainers and mannequins and things like that, the center itself is equipped with AV capabilities that allow capture of everything that's going on for analysis post hoc. So that means after the fact, we go into a debriefing session and discuss, depending on how the educational endeavor is being used. This might be a very formal feedback system where a checklist is filled out and, there might be some one-to-one feedback that's given as well. The rooms are set up. Some of the rooms are set up with two-way mirrors so that you can observe. A big piece of this is capturing everything that's going on so that you could then use it to augment feedback that is tailored to the learner.
So what are the standardized patients and where do they fit into the SIM Center?
Yeah. Standardized patients really represent a revolution in medical education that started in the 1960s as a result of two problem statements that a neurologist actually came up with. And I'm a neurologist as well. It makes sense. You're always trying to problem solve when you're dealing with such a sophisticated system. And what he had noticed were two things. One, that no one was watching the students engage with patients. So there was really no way to really ascertain whether they were graduating people that had that bedside competency. So that was one wrinkle that he identified. And the other one was that the neurologic exam is very difficult to portray. And so how does one simulate something that is as, oftentimes rarer neurologic illnesses also need to be taught. And so how do you teach those manifestations? And so the first standardized patient was a woman who was given the name Patty, who was a multiple sclerosis patient. And she was the very first standardized patient who worked with the doctor's name was Dr. Barrows, and he was in Southern California, to portray essentially her condition so that learners could advance their understanding of neurologic disease. And that's kind of where things kicked off. This idea that we need a standardized method to assess our learners. And we also don't really have a good way to simulate empathy. And the way to do that would be with a human actor. So someone portraying the role of a patient. In the very first instance, it was an actual patient, but now it's come to be healthy people who are portraying roles that fit certain assignments and educational goals.
Well, Mr. Capogreco, let me ask you about the program. What do you look for in a person who wants to be a standardized patient? Do they have to have an acting background?
So it's a plus, and certainly we find people who are gravitating towards this position who have that sort of acumen and background. However, our population of standardized patients is very diverse. We've got people who are former employees of Upstate who find that this is a great way to move into retirement. We have people who are in education. We have people who have been in banking, social work. So we kind of run the full gamut. Yeah, we do have a larger cohort of actors or people who have an acting passion, but it's not a requirement for the position itself.
Do you have any patients who are real patients that come in and portray the illness that they have?
Currently, no. We usually teach a standardized patient the material and have them portray that role for the students who are participating in the situation. Of course, all of us are patients, so we all have our own unique experiences and things to draw from. I think the uniqueness of a standardized patient program is the standardization of the information. So we'll be able to, in every room, deliver the same information, the same sort of physical findings, the same sort of affect, so that across the board, the students are given the same type of experience. I often joke with our students that honestly in the room, they're sort of the wild card because they're the ones we don't know what they're going to, we don't know how they're going to take this in what direction. So the standardized patients need to be adept at adjusting and still delivering the same type of information back to them.
This is Upstate's The Informed Patient Podcast. I'm your host, Amber Smith. I'm talking with Dr. Hesham Masoud, the director of the Upstate Medical University Simulation Center, and Matt Capogreco, who oversees the standardized patient program. So what are the qualifications to become a standardized patient?
The ability to work from 17 to 80. We really look for people that are flexible in their schedule, people that are consistent with them showing up. I mean, we depend on each one of these standardized patients to be paired with a student. So the whole program is dependent on them being punctual. Great memorization skills and recall skills. They don't have to memorize monologues per se, but they do have to memorize bits of information that come out at the same time. And then I think the thing you hit on earlier in terms of the feedback, that's the nugget that we give to the students, the ability to listen and to be able to give them feedback. So in a standardized patient encounter in several situations, after the encounter is done, the students come back in the room and the standardized patients will tell them, I felt this when you did this. And students don't ever have that. If they walked back in a room with a patient in the room and said, hey, how was that? How did I do? I think that the person might look at them cross-eyed. So we're able to give them real patient-centered feedback. And so our standardized patients need to be able to listen and be able to give that feedback in a constructive way.
So, Dr. Masoud, we've talked about some of the qualifications, but what are you needing for the standardized patient program from the community?
You know, I think one of the biggest value propositions behind the SP pool is this avenue for realism and diversity of representation in medical training. And that is a direct way to mitigate bias and support cultural competency at a grassroots level when healthcare providers are acquiring information at the very first point. And I think this is a way for the local population that we're serving to be represented in that education.
Is there a tryout, or how do you go about picking a person?
I think that this is such a unique position that we try to give as much information upfront as we can. So we do a presentation. It's a half-an-hour presentation on what standardized patient programs are and what the expectation is, and then give them an opportunity to digest that information and see if they are very interested in pursuing. We do have a secondary information session in person that allows for them to do a bit of role playing. And again, we believe that this needs to be a symbiotic relationship. They need to feel just as comfortable here as we are with them doing the role. And I can tell you, I think one of the things that struck me when I started this position is the amount of people in tenure that we have with people who have been here for years. And this is a part-time gig role. We have some standardized patients that have been here 15, 16, 17 years. That speaks, I think, to the interest, to the complexity of the position. And I think it speaks to the giving. They're really giving back to the students, and that value is an amazing gift. And it really does speak to the greatness of a standardized patient program and the role.
What are the working hours or the days? You said it's part-time.
Yeah, we're here Monday through Friday, normal business hours, and we're a very busy center. We have obviously multiple colleges and multiple sessions that are happening. So, on any given day, we can have 1 or 2 sessions that are in blocks, like a morning block or an afternoon block. So we're a pretty busy center.
So a person may be asked to come in 1 day a week or 2 days a week, or is it seasonal? Are there certain times of year where you need more standardized patients?
We definitely have peaks and valleys with programs that start up at different times of the year. Because we're a medical college, it is pretty much all year round. The only downtime we really have is around the holiday time. Otherwise, we're very busy. I tell our standardized patients as they apply, it really is up to them as to how much we have them come in. They can accept shifts as we send them to them. So they may come in 3 times a week. They may come in 3 times a month. They may come in 3 times a quarter. It's also dependent on the demographics. So all of these cases are based off a specific demographic. So let's say it's a male or female patient 50 plus. That's obviously going to have us recruit to that specific demographic. So you start to build your case files as an SP, and over time you become more trained in more cases and get more invitations. But it's also dependent on how many hours and time you want to spend with us.
So how much does a part-time job like this pay?
So standardized patients are paid at a $20 an hour rate. We pay for all of the training that they have, and some of that includes home training. So we in fact pay from home for them to review cases. We do have a few other elevated programs, like a breast program for breast examinations. That's a higher rate of pay. It's a different job position, but we do have people that participate in that as well.
And you said the ages, you have to be at least 17 up to age 80. What are you short on? Like, which age categories do you really need more of?
The male population in general is an area we need to focus on, especially the 50 plus. I think for obvious reasons, the 17 to 40 is always a difficult cohort for us to recruit. Those are typically those in school or in kind of the prime of their careers. So the daytime hours are a little more difficult. However, we do have people who have various jobs or nighttime jobs, or even those who have full-time jobs. We have a few people that work at Syracuse University, and they just love doing this. So as they have pockets of time that they're able to come and do work with us, they pick up those shifts, and they're valuable members of our staff. Everybody here as part of the team is valuable, whatever they contribute to what we do.
I'm curious about the training that's offered, and I wonder, does a standardized patient play the same role all the time?
So that depends. Start with the second question. A lot of especially our college of medicine students will be coming through every 5-6 weeks, and they will be doing the same cases with different groups. So yes, over the course of a year, you could be doing that same case multiple times. We have some programs that'll do a case twice a year, once a year. So it definitely varies, but yes, there is repetitive nature of doing those cases for sure.
Well, I'll ask Dr. Masoud, how accurate do you see the standardized patients being? Could they fool you and seem like they're a real patient with a real ailment?
Oh, yeah, absolutely. I think, a standardized patient is really the only avenue that we have to teach communication and empathy at the bedside in a sort of like Matt was saying, a safe and repeatable fashion. It's in the name, standardized. So it's just inherent to the human connection that can't be recreated with a mannequin. And what's a cool emerging space is how we're pairing task trainers that would require you to do something invasive with a standardized patient. So you can have a wearable, and that way you can deliver on a couple of different learning objectives. So you're wearing this thing where someone can do a task on, but you're also able to communicate. And that can be really important to teach medical providers about counseling and informed consent in the context of an actual psychomotor learning objective.
Amber, we do a program called Learning to Talk with residents, and it's really mostly about difficult situations, high-level standardized patient situations that are very tough to go through. And I, time and again, hear the residents above most come out and say, wow, like those standardized patients are amazing. They delivered that information and they stayed on point the entire time. And I think that they're really kind of taken back that they have somebody who will be that poignant with their role. And so, yeah, I think that the learners even notice the quality of the deliverable.
So the standardized patients, do they need to be prepared for having a physical exam where they'll be in a gown like they would in a regular doctor's office?
Yeah, there are limited physical examinations with several of our encounters where it would just be like a simple heart or lung exam or palpating your stomach, pushing on your stomach a little bit. They are gowned and they do have undergarments underneath, but yeah, they would have to be comfortable with a simplistic examination.
Now, I understand the standardized patients meet as a group to talk about policies and processes. How did that come about?
Yeah, recently I had a group come to me and said, would you mind if we got together and discussed our programs and give you feedback? And as a person who's been part of shared governance at Upstate for many, many years, I welcome that sort of environment. I love the fact that they wanted to band together and separate from me. They wanted to have their own space and their own time. And at some point, I'm sure that our leadership will be able to be part of their conversation. But the feedback I've gotten from them so far has been valuable. And a few of them have helped us to move process and policy in a different direction to help support them. Even if they are part-time employees, they are as much value to the team as any other person here. In fact, sometimes more, because I think that we depend on them delivering that information to a learner every single time expertly. And so, yeah, I think that they're banding together as a team is indicative of their interest in this program moving forward.
Now, how would someone learn more about applying if they're interested in this?
So our website is upstate.edu/simulation. You can also go to upstate.edu and search the jobs and put in standardized patient. It's also listed there. You can apply through that.
Well, I appreciate both of you making time to tell us about this program. Thank you.
Thank you.
Thanks, Amber.
My guests have been Simulation Center Director Dr. Hesham Masoud and Standardized Patient Program Director Matt Capogreco. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.